Do you have trouble falling asleep? You are not alone. According to Health Direct Australia, around 1/3 of Australians experience insomnia in some point of their lives. So in this video, we are going to talk about insomnia. Let's start. Have you heard of the word insomnia? Some of you may have, while others have not. How about sleep? You must have, as everyone does it. As we all know, sleep is very important. Sleep is an essential function that allows your body and mind to recharge, leaving you refreshed and alert when you wake up. Healthy sleep also helps the body remain healthy and stave off diseases. Without enough sleep, the brain cannot function properly. This can impair your abilities to concentrate, think clearly, and process memories. Sleep is important to a number of brain functions, including how nerve cells, or neurons, communicate with each other. In fact, your brain and body stay remarkably active while you sleep. Recent findings suggest that sleep plays a housekeeping role that removes toxins in your brain that build up while you are awake. Alright then, let's now have a look at the definition of insomnia. According to the studies on uptodate.com, written by doctors and editors, insomnia is defined as difficulty falling asleep, difficulty staying asleep, not being able to return to sleep, or waking up and not feeling rested. In general, people with insomnia sleep less or sleep poorly despite having an adequate chance to sleep. The poor sleep may lead to trouble functioning during the daytime. Here are the common symptoms of insomnia: difficulty falling asleep or staying asleep, variable sleep or inconsistent sleeping patterns, such as several nights of poor sleep followed by a night of better sleep, feeling tired during the day, forgetfulness and poor concentration, easily irritable, anxious or depressed, reduced motivation or energy, increased errors or accidents, and ongoing worry about sleep. You must know there are two types of insomnia: short-term or acute insomnia, and long-term insomnia, also known as chronic insomnia. Let's check what causes these types of insomnia. Short-term insomnia usually lasts a few days or weeks to 3 months and occurs in response to unidentifiable stressor. A stressor can be changes in the sleeping environment, like temperature, light, or noise, the loss of a loved one, divorce, or job loss, recent illness, surgery, or sources of pain, the use or withdrawal of stimulants like caffeine, certain medications, alcohol, illegal drugs like cocaine or methamphetamines, and other situations that can disrupt your normal sleep, like jet lag or shift work. Short-term insomnia can typically be resolved if the stressor is also resolved. Long-term insomnia lasts longer than 3 months and occurs at least 3 nights per week. This type of insomnia often occurs with other conditions, including mental health problems like depression, anxiety disorders, and post-traumatic stress disorder, medical illnesses, including those that cause pain, stress, or difficulty breathing, neurological disorders, such as Parkinson's disease and Alzheimer's disease, other sleep disorders, such as sleep apnea, restless leg syndrome, periodic limb movements, and circadian rhythm disorders, medication, alcohol, or illegal drug use, and irregular sleeping habits. The cost of poor sleep is much greater than people think. It may have profound consequences for our long-term health. Research has revealed that people who consistently fail to get enough sleep are at an increased risk of chronic diseases and medical conditions like obesity, diabetes, heart disease and hypertension, mood disorders, immune function, and life expectancy. So what can you do to improve or treat insomnia? According to the American Academy of Sleep Medicine, there are 4 different types of treatments available. The first is cognitive behavioral therapy, which has lasting benefits well beyond the end of treatment. It involves combinations of the following therapies: cognitive therapy, which aims to change attitudes and beliefs that hinder your sleep; relaxation training, which focuses on relaxing your mind and body. Sleep hygiene training, which corrects bad habits that contribute to poor sleep. Sleep restriction, which involves severely limiting, then gradually increasing your time in bed. And stimulus control, which involves going to bed only when you're sleepy, waking up at the same time daily, leaving the bed when unable to sleep, avoiding naps, and using the bed only for sleep and intimacy. The second treatment includes over-the-counter products. Most of these sleep aids contain antihistamine. They can help you sleep better, but they may also cause severe daytime sleepiness. Other products, including herbal supplements, have little evidence to support their effectiveness. Prescription sleeping pills is a third type of treatment. Prescription hypnotics can improve sleep when supervised by a physician. The traditional sleeping pills are benzodiazepine receptor agonists, which are typically prescribed for short-term use only. Newer sleeping pills are non-benzodiazepines, which may pose fewer risks and may be effective for longer-term use. And the fourth treatment is unapproved prescription drugs. Drugs from a variety of classes have been used to treat insomnia without FDA approval. Antidepressants, such as trazodone, are commonly prescribed for insomnia. Others include anticonvulsants, antipsychotics, barbiturates, and non-hypnotic benzodiazepines. However, many of these medications involve a significantly higher level of risk. So there you have it. Let's recap. Insomnia is an inability to get restorative sleep that causes daytime fatigue and sleepiness. It can be managed with cognitive behavioral therapies such as sleep hygiene, stimulus control, and occasional short courses of prescribed medication. So if you or someone you know is struggling with sleep, here are some healthy sleeping tips that we hope will help.